Hi, Dr. Todd Sullivan from Nova Chiropractic Acupuncture. One common condition we treat in our office is scoliosis. So a lot of times patients don't understand what truly scoliosis is. So everyone has a normal cervical curve, a thoracic curve, and lower back curve. Those different curves are normal. We should see those. So from the side profile, again, my neck has a normal curve, my mid-back has a curve going the other way, and then my lower back has a lordosis going that way. But what scoliosis is it's a deviation of the spine either to the left or to the right. A lot of times it'll happen in between your shoulder blades and mid-back area and then down to your lower back. And again, it may be very subtle or maybe very severe. Now actually I have scoliosis and mine is in that middle back area. Now you wouldn't typically see that from me putting on a shirt or anything like that. It's pretty hidden, but I actually have a pretty severe scoliosis. So what I'm gonna do is I'm gonna show you what it would look like when I'm bending over and you can see that scoliosis a little bit more. So again, mine deviates to the right. So when I'm bending over, what I'd like you to see is you can see a rib hump more on one side, and that's a sign that you may have scoliosis. So let me show you what that may look like here. So I'm gonna bend over here and just hang down here. And again, you may see that the ribs and the mid-back are kind of higher up on that right side versus the left side. In school, they used to check for scoliosis and you would get in a line, they'd have you bend over. They can see if there's more of a deviation of the ribs more on one side. But a lot of times people often don't know that they have scoliosis. They'll come into me, I'll assess their spine, and then we'll see that they have a curvature. And the issue with that is it creates a lot of stiffness in that area where there's a curvature. And when there's that stiffness in that joint, it puts pressure above and below that area and causes premature wearing down and a lack of mobility and causes increased pressure on that area. So what we do is we like to help to increase that stiffness in that middle area where they have that scoliosis, and then obviously treat above and below that area to get those areas moving as best as they can. Now, most of the time you're not going to correct the scoliosis. All you can do is manage it and help to reduce a lot of the symptoms. Once your bones get to a skeletal maturity, you're not going to be able to alter that scoliosis very much. Sometimes if it's very severe, they will surgically go in and they'll put rods along the side of your spine to try to minimize it from going out any further, because if it goes too far, it could impact some of your organs and compress some of that area. It's very rare that they have to do that, but it is an option if it gets really severe. Most of the time it's a very mild kind of scoliosis and we can manage it in the office and help reduce that pressure over time. So that's one common condition we see with patients in my office. If you have any more questions about scoliosis, reach out to me at 703-912-7822 or schedule online at novachirowellness.com.